Welcome to week 4 of the Kid and Parent Pregnancy Show. I am Asha. Some of you might be experiencing pregnancy symptoms. This week, we will talk about early signs and symptoms of pregnancy and how to confirm your pregnancy with the help of a pregnancy test. You will also find out why it is essential for an expectant mother to be on a balanced diet and what is an ideal diet during pregnancy. Changes taking place in mother. At this stage, your body is undergoing many hormonal changes. During pregnancy, a hormone called human chorionic gonadotropin, also known as HCG, is produced. This hormone helps the ovary to produce the progesterone hormone, which maintains the growth of pregnancy. These hormonal changes are responsible for morning sickness and other symptoms you might face during pregnancy. Some women start experiencing early pregnancy symptoms at this point. How is baby doing? You may think it is too early, but your baby's spine and brain have started developing at this stage. By the end of this week, the embryo will get attached firmly into the lining of your womb. The embryo is attached through a stalk which will later form the umbilical cord. The cells in the embryo start developing into your baby's organs and body parts. Did you know? Approximately 70% of expectant mothers experience some symptoms of morning sickness during the first trimester of pregnancy. Early pregnancy symptoms: missed period and breast tenderness, exhaustion, tiredness, nausea, and vomiting, frequent urination or increased vaginal discharge, mood swings and headaches, strange food cravings, and increased salivation. Please remember, these are just the indications. You might have all of these or none of these symptoms. Your pregnancy can be confirmed only with the help of a pregnancy test. Pregnancy test. Pregnancy tests detect the amount of HCG in either the woman's urine or blood sample. The levels of this hormone rise after the woman has conceived. They are usually detectable within 10 days after conception. So, if the pregnancy test is performed about the time the woman misses her period, detection through this method will be possible. How to do a pregnancy test. You can perform the pregnancy urine test in the privacy of your home. Buy a pregnancy test kit at your local medical store. Follow the instructions on the strip carefully to get the most accurate results. You will get results within a couple of minutes. The results are generally accurate but can sometimes generate false negatives for a variety of reasons. You can alternatively do a pregnancy blood test, which is more sensitive than a urine test and thus more accurate. A blood test measures the levels of HCG in your blood instead of urine. This can measure lesser hormonal levels in the blood and can detect pregnancy earlier than urine tests. However, these tests cannot be done at home. You may have to get your doctor's help in doing these tests and draw blood through a needle. Home pregnancy test kits in India. There are many pregnancy test kits available in the Indian market. The accuracy of the test depends on how it is performed, so read the instructions carefully before performing the test. Some of the products are listed below. Velocit by Dr. Reddy's, Freg Color Card, Clearview, Cadilla's AccuTest, Econ Kit. Frequently asked questions. Is it possible that the pregnancy result is negative, but I am actually pregnant? Yes, it can happen in case you have used it too early, even before the HCG hormone can be detected. You have ovulated at a date later than you expected. Your HCG levels are real low. So, If you get a negative test but are not getting your menses, please repeat the home pregnancy test again after a few days or visit a doctor for confirmation. Tip of the week. If you're planning to get pregnant, consult your doctor about any long-term medications you're on. Nutrition during pregnancy. Every mother wants to ensure that she delivers a healthy baby. She needs to provide nutrition both for herself and for the growing fetus. It is recommended that the pregnant women should take extra 300 calories irrespective of activity. Her diet should be balanced, rich in proteins and fats, contain liberal amounts of vitamins, minerals like calcium and iron, and fluids along with high fiber. Here are some tips for a healthy pregnancy diet. Tips for a healthy pregnancy diet. Dairy products are the primary sources of calcium. If you do not like milk, use curd, cheese, yogurt, or koa. Green leafy vegetables are also good sources of calcium. High sugars and more refined foods should be avoided. Foods that supply empty calories like soft drinks, junk foods can also be avoided. Needs of essential fatty acids increase during pregnancy. Fats can be taken in prescribed amount, but products like vanaspati and dalda, which contain saturated and trans fats, should be avoided. Instead, use products rich in unsaturated fats like olive oil, fish, and avocado. If you're a vegetarian, increase your intake of legumes, pulses, and nuts to meet your protein requirements. Infobite. Normal calcium requirement of 400 mg shoots up to 1000 mg during pregnancy. Increased calcium intake helps the growth of fetal bones and teeth. Fetal skeletal growth peaks in the last trimester. The mother should increase her intake of calcium-rich food, otherwise the fetus will draw from the maternal stores. Words of wisdom. Have a nice week with this lovely Chinese proverb while awaiting your lovely baby. There is only one pretty child in the world, and every mother has it.